muscle weakness, rapid fatigue, shortness of breath during physical exertion, gratuitous palpitations. Did you know these are symptoms of aortic stenosis? My name is Doctor.Global, and let's discuss this disease in more detail. What is it? Aortic stenosis. Aortic stenosis is one of the most common heart defects. In this disease, the first part of the largest artery in the human body narrows. The pathological process affects the semilunar valve connecting the left ventricle to the aorta. In its normal state, it uses 3 valves to block the return flow of blood from the aorta to the ventricular cavity during relaxation of the heart muscle between contractions. Abnormal narrowing of the semilunar valve prevents blood flow to other organs in the body, and they do not receive enough oxygen and nutrients. With aortic stenosis, there is a significant difference in pressure between the aorta and ventricular cavity, and the load on the heart muscle increases in all parts. Over time, the patient develops a severe hemodynamic disturbance. Symptoms. In the early stages of the disease, patients do not feel severe discomfort for long. The first signs of aortic stenosis appear when the aorta is narrowing by about 30%. At this time, the heart stops compensating for the valvular defect with increased work, and the person begins to feel muscle weakness, rapid fatigue, shortness of breath during physical exertion, gratuitous palpitations. Because of these symptoms, it is difficult to suspect the development of cardiac pathology, so many people are in no hurry to visit a cardiologist. As the disease progresses, specific signs of heart damage appear: heart rhythm disorders, angina pectoris, periodic pressure, squeezing or pulling on the back of the sternum, shortness of breath during exercise, after exercise, and even at rest. These signs are complemented by nonspecific symptoms: pronounced swelling, frequent dizziness and headaches, weakness, rapid fatigue, periodic loss of consciousness. The clinical picture may vary in the presence of concurrent heart disease or disease in other organs. There are 3 causes of aortic stenosis. Congenital heart defects. Congenital aortic valve stenosis is often associated with malformations like bicuspid aortic valve or congenital narrowing of the aortic orifice. Typically, congenital valve stenosis affects patients under the age of 30, while acquired ones occur after 60. Rheumatic fever. Acquired pathological narrowing of the aortic orifice most often occurs as a complication of poorly treated strep throat. The damaged valve flaps become dense, rigid, and fuse. Aortic valve calcification. Calcium deposits can accumulate on heart valves, causing stiffening, especially in individuals with congenital aortic valve defects. Symptoms of aortic valve stenosis related to age and calcium buildup typically appear around age 70 or 80. Diagnosis of aortic stenosis. First, the cardiologist will take a medical history, listen to the patient's complaints, and perform a physical exam. Diagnostic tests to detect this pathology include ECG, chest X-ray, echocardiography. Cardiac catheterization, an invasive diagnostic technique, may also be used to help clarify the diagnosis. Laboratory tests for blood and urine tests are of an auxiliary nature. Living with aortic valve stenosis. Individuals with aortic valve stenosis can lead active lives with appropriate treatment and lifestyle adjustments. Education about the condition, adherence to treatment plans, and consistent medical follow-ups are vital. Treatment of aortic valve stenosis. The choice of treatment strategy is determined by the degree of stenosis of the valve and the severity of the symptoms. The main treatment strategies for aortic stenosis are medical therapy and surgery. Conservative treatment. The treatment is symptomatic. No drugs can stop the narrowing of the heart valve and restore the left ventricle volume. Conservative treatment is performed to relieve symptoms. The patient may be prescribed certain medications that can control the heart rhythm, lower blood pressure, stop the pain behind the sternum. This type of treatment is carried out both before and after surgery. Surgical treatment. It is the most effective way to get rid of a patient's cardiological problem. Several different interventions are used to eliminate valve failure. Aortic balloon valvuloplasty. A special balloon is inserted into it to enlarge the orifice of the aorta. Valve repair. For severe stenosis, dissection to change the structural elements of the valve is performed. Open heart valve replacement. A new valve is implanted in the patient. It can be either biological or mechanical. Transcatheter aortic valve replacement, TAVR, a minimally invasive procedure ideal for patients at high surgical risk where a new valve is inserted via a catheter through a large artery. Aortic valve stenosis is treated in hundreds of clinics worldwide using different approaches and equipment. However, not everyone knows that the cost of treatment in different countries can vary widely, even with the same high level of quality. For example, procedures such as aortic valve replacement or Ross surgery can cost twice as much in Israel, Germany, and the UAE as in Turkey and India, but half as much as in the US. In order to find the appropriate treatment conditions in advanced clinics around the world, we created the Doctor.Global service. The platform is designed to help people get a second or third opinion, choose the best clinic location, or find the right cost and treatment date. We act as an involved mediator, helping to obtain comprehensive information from clinics, translating and organizing the patient's medical records in any language, and enabling the patient to make a meaningful choice of clinic or doctor. Follow the QR code link, click your request at the bottom of the screen, and describe your case. We will contact you back for confirmation and immediately start searching for treatment options, considering all your wishes. Nothing is more valuable and important to us than your health. Advances in aortic valve stenosis treatment. Recent advancements in valve replacement techniques, particularly TAVR, have significantly improved outcomes for patients unsuitable for open-heart surgery. Ongoing research is focused on developing better prosthetic valves and less invasive treatment approaches. Rehabilitation. Patients stay in the hospital for the first week after the operation. They will be monitored around the clock by specialists. After discharge, the doctor will give a list of nutrition, exercise, and lifestyle recommendations. These must be done strictly. Also, during recovery, you must regularly visit your cardiologist and undergo an examination. Prevention. Preventive measures are limited to preventing the development of diseases and pathological conditions that can cause aortic stenosis. People who are found to have initial changes in the aortic valve and those at risk should be seen regularly by a cardiologist and rheumatologist. Hope you have learned something useful today. Do not forget to like this video and share with your friends. We sincerely wish good health and success to you all.